are eating. I've asked Chief Puckett to come forward, and then he's going to introduce our special guest also. We're delighted to have Chief Puckett, if you'll come forward. And we're going to meet and eat at the same time. We're going to dispense with the minutes and the treasurer's report and let our guests have a little longer time to speak, okay? Thank you.
Hey, how's everybody doing this morning? Or this afternoon? It's nice to see y'all again. It's unfortunate that Connie can't. Can everybody hear me? Okay. It's unfortunate that Mr. Connie can't be here. I grew up with knowing Connie through Larry and Alan and Kelvin and my brother-in-law, best friend Jeff. We used to go over there all the time. So that's very unfortunate for that family. So please keep that family in your prayers. What we're going to talk about tonight or today is dementia. And this is one of those issues that's near and dear to my heart. I'm not going to mention his name because I'm being recorded by Southern National News, and if he hears his name, he's probably going to kill me. But this is one of those things where if you have been exposed or you know somebody with any form of dementia, think about it in your head. Most people in here have. At some point in our lives, we're going to know a family member or a friend that has dementia. And this is one of the issues that we have to deal with in law enforcement. So it is a law enforcement issue, and it affects us. But I met Marla, who's a registered nurse, through this family member. This member here was experiencing dementia. He was leaving home. His wife couldn't handle him that well. He's very independent thinking. He's always, for his entire life, and as long as I've known him, done what he wanted to do because that's the type of man he is. He still does that. However, he has a hard time remembering things and remembering maybe even how to get back home if he walks away. So I made contact, well actually my wife made contact with Marla through Amedesis, right? Amedesis. Out of Franklin. Marla came and she spoke to us and she gave us a lot of forward-thinking ideas that we as family members hadn't thought about. Since then, I've gone and put alarms on the door so if the gentleman does leave, his wife knows that he's leaving the house. Marla was nice enough to come in and talk to us about ideas such as weighted blankets and things like that, and she's going to talk to you about some of those ideas. But as a caregiver, we're not nurses. Marla is. So we need somebody to show us how to deal with this crisis. When somebody has dementia, they may not think as clearly as we do now, but in their mind, this is really happening. And we have to know how to relate to those individuals. And that's what Marla's going to be here to do. Because if, for example, this gentleman, if he says there's somebody behind his couch at 3 o'clock in the morning, in his mind there's somebody behind his couch at 3 o'clock in the morning. And I have gotten up out of bed and gone to his house and looked behind his couch. Although I know there's nobody there, his wife will tell him, no, there's nobody there. But we can't do that. We have to know how to treat these individuals because that makes that person agitated. In his mind, it's really happening. So those are some of the ideas and some of the thinking strategies that we have to know about, and that's what Marla's going to talk to you about today. And there are a lot of resources out there that I even didn't know about, and she's going to talk to you about that too. So no further ado, I'm going to introduce Ms. Marla Matthews.
Hey everybody. So I know several of you because I'm actually from here. I lived here for a really long time, and I worked for Dr. Weeks here in Spring Hope. So I know several, I think I've already spoken to several of you. So thanks for having me today. I have my notes on my phone because they actually printed out forward and backward on the printout that we brought in. So I'm going to use my phone some just so I won't forget to go over anything. But I think probably most of you have come in contact with some form or somebody that has dementia before. It's a lot harder when it's a family member or a spouse or a loved one because you don't want to accept it and they don't want to accept it. So having somebody from the outside come in and go over these things with you. For example, the person that, and I'm going to try not to say the name too.
It's difficult.
The person that we were just discussing over here, his wife told me They are not going to accept it. When you go in there, they are not. But when I went in and sat down, we probably talked about the idea of a medicist hospice coming in for 5 minutes, and she was already on board. It was more us just chit-chatting about people we knew and where I was from the rest of the time. So, strategies for dealing with the things that were going on. But other than that, you know, it's just somebody from the outside coming in and reaching for other resources when you're having issues. That's the biggest thing. So, you know, dementia is really not a specific disease. It can come from many things. It can come from Parkinson's. It can come from the actual Alzheimer's. It can come from actual trauma to the head. So it's just a word that people use for, you know, memory loss or cognitive deficits. One thing we do, we have a hospice side and we have a home health side. The hospice side, a lot of people, when they hear that word, they cringe. But patients come with us on hospice and they can stay with us for years. They can come on and they can come off of hospice. It doesn't mean that they're going to come on and stay with us and that they're going to be with us until they pass away. They can improve and they can actually be discharged, or we can move them back to home health to continue to strengthen them. But one thing we do with hospice, as he was talking about, is we have an end-stage dementia program. So our program, we come in and we have a kit. But we don't just walk into every patient and say, here's your kit, because some of the things in the kit may not work for everybody. But in our kit, we have a weighted blanket, which works for patients that have high anxiety. So your patients that are wanting to get up and walk or wander or get combative or sundown. Does everybody know what sundowning is? When the sun starts to go down, they get real active or upset. You can use the weighted blanket and it helps calm them down. And it's not big, it's really small. So if they are in a nursing home or assisted living, it's not considered a restraint. It's a light lap-size blanket. We also do an activity lap pad. So it lays right on their lap and it has things that they can fidget with. And that's made by our volunteers. So it has buttons on it. It has a little thing that makes like the crinkly sound. It reminds me of a mat that you lay a baby on when they're first born, but it actually goes on the lap. You can lay it on the bed with them so they have something to play with. And that's really good too for patients that have Parkinson's because they roll, their hands roll, and they like to have something they can fidget with. So if they're actually pulling on blankets or turning blankets, they can use that blanket, the activity pad instead. Another thing that's in it is the shampoo cap, and I was actually going to bring it today, but I had field day this morning and didn't get a chance to bring it. But it's a shampoo cap that doesn't require water. So a lot of patients that have dementia and they get upset, they don't like things to go on their head. Like they don't want water poured on their head all the time. So you can use this shampoo cap with a dry shampoo, and you can use that to wash their hair instead of having to wash it under the sink or in the bathtub every day. It has washcloths that are the size of an actual washcloth, but they're baby wipes. So you can use those for bathing. It has regular wipes in it. And then it has things to prevent aspiration. So patients that are having issues with swallowing, dysphagia. We have a nosy cup is what we call it. So it has the little nose area cut out on it. So when you're helping them with their sips, you can see how much they're actually getting. But you're not making them drink out of a straw all the time. And then it has a little spoon that's plastic. But the bites are about this big, which is what they should be taking anyway. You can give them a bite, let them take a bite that's not really any food on it, but they think they're still getting a bite, and then another bite. And that's kind of more for the end of dementia stages versus in the beginning. But that helps with them preventing them aspirating and causing pneumonia. So that's teddy bear or a baby doll if they need it. Sometimes they don't, but it is a good, we've had so many patients in the skilled nursing facilities that absolutely love the baby dolls when they get those. And you wouldn't think so, but they do. They like to play with their hair and fix their hair. So that's the kit, but then that also, the nurses work with them on documenting goals and setting goals for them or seeing the progression. So that way if they are declining or if they aren't declining, we can set goals for that with the doctor. With the home health side, we have a fall reduction program. So if the patient's having issues with walking, we can actually go in and give them a monitor. So it's like an emergency alert monitor, except they never have to push anything. It goes on their wrist or their neck, and that detects if they go from vertical to horizontal automatically. and it can ask them, are they okay, before it alerts anybody, but it will alert up to 5 people. And then they get a book in the home, and that is something that we set goals in. The patient can write in it, the nurses take pictures, and it goes into their records. They take that to the doctor with them. So they get that for fall, COPD, and heart failure goals for those programs. Other things that we do with dementia, I'm going to pull this up so I can tell you the exact information. One person I use a lot for dementia, I don't know if any of you know Ashley Winstead at the Senior Center in Nash County. Have any of you come in contact with her if you go there? Okay, so she is phenomenal.
And she actually came to our board meeting Monday night and spoke about some of the senior resources, specifically dementia. What we're trying to do is we're trying to put on a training for law enforcement through Ashley. And one was done several years ago, but it's always good to refresh law enforcement and first responders on responding to dementia patients. We had a gentleman come to the police department a few months ago, and he was looking for his wife. He was a local resident, lived just outside of town. His wife left him a note, and she wrote on the bottom of the note, it was 9:54 when she left, and she was going to the hairdresser. For her hairdresser was right in town, you know, and it was Miss Sylvia, she had retired by then, but it was right in town. This was about 11:45. He couldn't find her. So he called OnStar, and OnStar would not give him the location of his vehicle without law enforcement allowing him to get that. So we called OnStar, and my lieutenant was in there, and I said, well, look, call your wife back, find out if you can find out the general location. And she was at Precision Cuts and Trims was the name of the beauty salon or barbershop she was at. So as we were using the wonderful internet, we found out that the closest one was in Chapel Hill. And she said she was in Lewisburg. So I said, well, find out what street she's on. Now, at this time, at this point, she had become a little bit agitated. And he couldn't tell her that he was at the police department. So he found out she was on Rosemary Street. Sure enough, 316 Rosemary Street, Chapel Hill was the address of Precision Cuts and Trims. So we called up there, and finally OnStar came back with the information. When she's in Chapel Hill, yeah, we know that now. Thank you. So we called Chapel Hill Police Department, and I got in touch with the dispatch up there. They sent their crisis assessment team out there. First we called Precision Cuts and Trims. Let me back up. And they said, yes, there's a car matching that description out here in the parking lot. I said, can you go check on her, make sure she's okay? Sure enough, she was sitting in the passenger seat of her car. And when Chapel Hill Police got there, they sent the crisis assessment team out there who's trained in relating to these types of calls. She was waiting for her husband to come out of the barbershop. She had made it all the way from Southern Pass Road to Chapel Hill. So those are the types of calls that we get now more and more frequent on a daily basis. So as law enforcement, we have to learn how to deal with it. But my main concern is to make sure that the community knows how to deal with it too. Because if you approach somebody who thinks that they are seeing something, or thinks that they may be having a hallucination, it's very important for you to know how to treat that individual, especially if they're a family member. And it's bad enough to see family members. This gentleman we're talking about, smartest man I've ever met in my life. I mean, he could tell you how much a sheet of toilet paper cost on a roll in a matter of just a few minutes. I mean, he was that smart. And to see him decline like he has is sad. But we owe it to those individuals to treat them with the utmost respect. So we need to know what type of training we need to seek to make sure that we are treating them the way they need to be treated. And these are the professionals. And as I said, that's how I met Mara, and she has helped us a whole lot, our family. And I've referred other people to her here in town and thereabouts, other places. Ashley Winstead, you know, we talked with her a lot. These are resources that we have available, and we have to use them, and that's why we're here today.
One thing we really want to do, Ashley and I have worked together a lot. We have a meeting at the Senior Center once a month. Is we want to try to make the community dementia friendly. Up near the coast, they have a dementia friendly community. So all the restaurants are trained. You know, any community public building is we're trying to get them all trained. So here we want to make that, you know, when you go in the hospitals and you see the little star on the doors, that means patients are a fall risk. So we have to take extra precaution to make sure they don't get out of the bed and fall down. Well, we want to do that also with our dementia patients, because that means they could be a wonder risk. they could get up and walk out of their room and wander the hallways and no one would ever know. So we want to make sure we take extra precautions with them too. So if you train your restaurant staff with these patients, you could have a patient and you can't look at them and tell that they have dementia. You can't. I mean, they look like you and I. And there's nothing wrong with them having dementia, but we have to know how to approach these patients. So, and these human beings, let's not call them patients. I'm just a nurse, so I'm used to saying that. But when you go up to somebody and you bring them their order and they say, I didn't order this. Well, you know that they ordered that, but you need to know, okay, all right, wait a minute. This person's maybe not being ugly to me. Maybe they really believe that they didn't order that. So take it back, walk away, and come back again a few minutes later and try to give them the same thing again. Don't argue with them. The second time, chances are they'll probably take it from you.
It's all about education. This gentleman I'm talking about now, his wife and family would take him out, and before, we knew, and we were educated on what to do, he would sit down, and he would only sit down for 2 or 3 minutes, and he would get agitated because his food wasn't there. Now we know.
The
but
concept
we
of
didn't know
time is
before.
not there.
Yeah, so I mean, and we didn't know before, and that's what we're trying to do is educate the community. My grandmother, many years ago, I'm not going to tell my age, but my grandmother many years ago, she had dementia. At the time, we didn't know what it was. I mean, I just thought she was being mean or crazy, and I'm joking, but she had it, and we didn't know what it was. Well, now it's being diagnosed more and more frequently, and we're more educated now than we were 25 or 30 years ago. So the goal, like Marla said, is to get the information out there to everybody, because if we know what to look for and we know how to treat these individuals, then we can treat them ourselves a little bit, and that's what I mean. It's being human.
And we
being
don't
a
want
human
families, having to keep their loved ones at home because they're scared of what's going to happen when they go out, Like, we want the community to know how to interact with the loved ones so that they can go out. And, they have all these communities overseas that are dementia-friendly communities, and they live on their own, and they can thrive because the communities know how to handle them when they go out. They feel safe. And one thing we want to try to do is prevent the ones that are wandering and walking down railroad tracks before they get out, before they go wander. So families are prepared and they know what to do in the home to keep them from wandering. It won't happen.
And Nass
I'm
County
not saying it won't happen all the time.
Nass County also has a Project Lifesavers. Anybody heard of that? Project Lifesavers is a program where you wear a band. The individual wears a band that has a GPS tracker on it, and you sign up for Project Lifesaver, and then they can track that individual. So if the individual does get lost, then they can be found. Now, this gentleman I'm talking about, he will not wear a band. He would cut it off.
That's the issue with
and
the
that's the
Project
issue with the Project Lifesaver. But I want to let you know that it is available.
And it's free.
And it's free.
They do take donations, but it's absolutely free. And it's for children too. Your autistic children, anyone with a cognitive disability, it goes for that. And you just contact Ashley Winstead, or you can call me and I can get you in touch with her at the senior center.
At the senior center.
For that.
And my number is 459-1365. And I just remembered it because my wife's extension is 1265, but hers is 1365. But we will be doing training in June, and Southern Nash News actually recorded the board meeting Monday night as well, and she was there speaking, so her information is on there too. But if anybody needs it, feel free to come by the police department, and I'll give you her information if you know anybody who may need it.
I did put a few tips up here for you guys just for home safety if you have anybody that you're trying to get the home safe for. So your environment, you always just kind of want to check the environment, make sure that if there's doorways that go down to basements, try to keep those locked just in case they forget that's where it goes and they open it and step through. Your rugs, your throw rugs, try to keep those at least underneath something so they can't trip over it and fall. I know how people are about their rugs. I've had patients, I've gone in and pulled rugs up 10 times, and every time I go back, they're back because they like their throw rugs, and that's fine, but we just have to make them so they're safe. Just different things like cutting the gas valves off to the stoves, making sure if it is a gas stove, or cutting the appliances off so that they can't use them, so that they don't cause any fires. There's things like checking the water, making sure that they don't leave it running. I've had patients that have left the home and left the water running and flooded the home. So just little things like that we have to be careful about. Installing the locks, as we talked about. up so that they can't, get to them, or they don't realize that they're there, or having a bell installed, a dinger, so that when the door's open, it dings, and you can hear when they're opening and shutting the door. Walkways lit up, so at night, having some kind of night light in the hallways. That's one thing we give with our fall prevention program, our fall reduction, we give a night light too, that they can put somewhere in the home to help keep it lit. Weapons, putting weapons away, locking them up, just because if they feel like he said, somebody's behind my couch, you can't tell them that there's nobody behind their couch. You have to go and maybe show them, oh, well, let me see who it is, or redirect their attention. Try to get them onto something else if they won't let it go.
And I think redirect is the key word.
Yeah.
You don't tell them they're wrong. Like Marla said, you redirect their attention somewhere else. It's like this individual here, I've been over there before, and he had his hand in his face, and he said, I want to go home. So we rode him around and brought him back home. And when we drove in the driveway, he said, I'm home. That's it. Spend a little time with him, because there's no need to tell them you're home. They may not know they're home. So we directed their attention. We rode him around, rode him to some familiar places. He come home. He said, I'm home. It looks good. And that's the thing is, we owe it to them. I mean, they were there for us, and it's time for us to be there for them. And that's what we have to do as human beings.
You always want to make sure you support them. So whatever they need, if they don't like how restrictive you've made the house, maybe try to change one little thing and just kind of get their mind off of it, and you might can move it again later, just to make it safe. But if they see you do it, that's when they get upset about it. Another thing that I'm huge on, and it just popped into my head, is continuing to do activities to stimulate the mind. Doing puzzles. If they like old cars, like putting together model cars, do model cars, play card games, things that stimulate memory. One thing I like is reminiscence therapy. So I like to get out photo books, or bringing out photos and telling stories about the time this happened. So when did you take this picture? And then having them tell me stories about it, because it triggers that memory. It makes them dig deep and think about things. So I like to do stuff like that. And then music therapy has been shown to really work well too. So listening to music. With our end-stage dementia patients, we actually go out and make them music CDs. And playing those when they get really upset or agitated has shown to really help a lot, calming them down with stuff that they like. We've made bluegrass, we've made country, we've made pop. I mean, whatever they enjoy is what we'll make for them. And then I had the Project Lifesavers on my list to go over with you guys. Putting away cleaning supplies and medicine, locking up medicine. You may have to do the medicine in a Medi-Planner. One thing I did for my mom was I bought a locked medicine container, and it had a timer on it. So it would go off when she was supposed to take it, and then it would not stop until she turned it upside down and dumped it in her hand. And then it would spin to the next time. And I think I paid $19.99 on Amazon for it. And it worked really well, because I couldn't be home with her during the day. I had to work. So that worked really well.
And if I may, it's always a good idea to lock your medicine anyway. And if you need a lockbox, or a family member who may need a lockbox, we do have some in the police department. But it's always a good idea to have a little lockbox to keep the medicine locked away, especially the prescription narcotics. And we need to keep that locked away if you have any children or anybody in the house anyway. I'm sorry.
And if your loved one ends up on hospice or home health, usually if you tell them that you want locked medication, they'll provide that stuff for you too. All you have to do is request it.
But that's pretty much what we have. Does anybody have any questions or comments that you would like to make as far as the presentation? Any questions from Marla?
Marla, where are you located?
Well, our office is in Franklinton, as he said, but we have nurses, physical therapists, occupational therapists, speech therapists, and we're located all over. So we are located based off of where our patients are. So we can see patients here in Nash County, Wilson County, Franklin County, wherever.
And she's got some business card packets over here.
Yeah, I left some of my information here for y'all, so you can have it.
Marla, did you say there's a support group, or is there particular classes or something that would help you if you were a caregiver?
If you call me, I can get you in touch with somebody, but most of the time, any of your assisted living facilities are gonna have some kind of dementia support group. And you don't have to have a loved one there to go to them, because they want outside people coming in so that you can see their facility anyway for future. Yeah.
The question I have is, sometimes the person becomes hostile,
Combative.
right?
Mhm.
And maybe even threatening to kill his spouse. How do you go about handling those situations?
Well, we try to use non-pharmacological methods first. So we try to not use the medicine if we don't have to. But there are medicines available that you can do, like anti-anxiety medicines that a lot of patients have to end up taking. But the weighted blanket that we have, that's for anxiety, and it's been shown to work for autistic children and combative dementia patients. That works really well. Redirecting music, that's relaxing. Trying to get their attention onto something else. You know, talking to them about something else, but you gotta have to be fast about it. You gotta get that attention. So what's this over here? Or, you know, just kind of going into a different topic.
I will tell you the way the blanket works.
Yeah, it does.
This individual I'm talking about, his wife would drive him around, and he would want to go to the beach 3 o'clock in the morning. And she would drive him, and sometimes she's made it as far as Wilson or further. Since Marla's in it and come over and introduced this weighted blanket, his anxiety has not gotten so bad where he wanted to get up out of bed at night. It's often.
And it's not big, and that's the key. Because, you know, you can buy these big weighted blankets at the store that go over your whole bed. Those are too heavy, and they get hot at night. This one's just a little lap-size weighted blanket that we give in a kit, and all that's covered on the insurance. So none of that you have to pay for. It's machine washable, super easy. It's just a little bitty blanket, but it's just that tad of making you feel cuddled, I guess. That works.
Could that spouse call you directly, or must you go through the sheriff or the doctors?
You can give her my card. She can call us directly, and we can go through her physician to get everything we need.
And as I said, I've used her for references for other patients here and around town too. And that's what her company has done is gone through the doctor's office.
I work with, I go into the hospitals, and Mariah Parham and Nash, all the doctors around here, the nursing homes, I do education with them, and I work on, my title is actually a care transition coordinator. So I educate, and then I go in and work with patients and transition them back into the homes with home health. I did hospice, but now I do both until I get finished training the new hospice girl. So I can do it all.
And then what we do is we go through the senior center here in Nash County, and the senior center contracts with her and other companies.
Dementia's my passion, though. I really enjoy learning more and working with dementia patients.
Any other questions, comments? Thank you for having us. It was a joy to be here. You know, it's always wonderful coming in here because I know most everybody in here. So I enjoy coming here, and I do appreciate it.
Thank you so much.
Thank you.
I appreciate that so very much, and Deborah, I forgot to thank the food groups for the good food. Are there any June birthdays? We do have a June birthday. Where's Birdie? Birdie's got it. No, I don't. Oh, okay. She's gonna lead us in happy birthday. Okay, thank you. Ready? Happy birthday to you. Happy birthday to you. Happy birthday, God bless you. Happy birthday to you. Thank you so much. And I hope you do have a good birthday. We do have one item of business that I need for you all to think about. We're running low on tables. Our group has grown, that's a good thing. The other tables that are back there are extremely heavy, which means that in setting up, we can't set up because the tables are heavy. So if I could get a motion from someone, I'm not sure how much a table would cost. We need one additional table for our group. If you'd like me to check the cost of it and then present it to you next month to see if that's something you want to do, I can certainly do that. And then but be thinking about that, and that way we'll know how much it is gonna cost. If you want one or two, that would be great. What is your feeling on that?
I make a motion, we buy the tables, as is, don't worry about giving us pre-notice.
Okay.
Somebody-
I have a motion on the floor, and I have a second. Any discussion?
Can you find somebody stronger? You got
Well, Marshall, if you would like to come and help us set up
Well,
on
I
YouTube,
can
we'd
imagine
love
the
to
table
have you
being so
come
heavy,
and
so if you can't get it out, that's pretty good.
And they're really, when you stack them up and you're trying to get them, they are very heavy. Any further discussion other than Marshall? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you so much. We'll get us a table. I appreciate that. Next month, our guest is gonna be Carvel Chiefs, our bluegrass singer and clown, comedian, whatever. He's gonna be here. Laura's group has the food assignment. And is there anything else that we need to bring before the group? Thank you, visitors, for coming. I hope you had a good time. And Deborah's group's in charge of the cleanup, and the Go Valley seniors are not meeting until September. Okay? We'll see you next month.